Good morning. Welcome everyone to the COVID-19 media briefing. I'm Carrie Schutte, the Public Information Officer for the Shasta County Health and Human Services Agency. I'll start with the numbers. We have had 7,416 confirmed cases, including 55 from Sunday and 71 from Monday. We have done a total of 101,934 negative tests for a total of 109,350 tests. As of yesterday, our regional ICU capacity as listed by the state was 29.5%. We've got about 500 active cases of COVID in our community. There are 57 people in the hospital, including 7 in the intensive care unit. And thus far, we have had 70 people who have been confirmed to have died from COVID, Shasta County residents. Today with us, we have Donnell Ewert. He's the director of the Shasta County Health and Human Services Agency, standing in for Robin Schurig, our public health director. We have Dr. Karen Ramstrom, who's the Shasta County Health Officer. We have Mark Mitchelson from Shasta Regional Medical Center and Robert Folden from Mercy Medical Center, Reading. Who would like to get us started today?
Well, I'll get us started. As Carrie said, we're still in the purple tier. As of today, our adjusted case rate is 36.8 per 100,000. That's our daily rate. Our unadjusted rate is 40.1, and our adjusted rate is 36.8. That takes into account our testing volume. Our testing positivity rate 7.9%. As far as ICU capacity, it is 28.8% in the northern region, which is quite a bit higher than the 15% threshold for going into stay-at-home order. So we are doing quite well in that regard. In Shasta County, 13.3% of the ICU beds are available, and 23% of the cases in the ICU are COVID cases. So, we do continue to see a large number of deaths, which is kind of the classic presentation. You have a surge, which we had kind of after Thanksgiving, and then you have a high rate of hospitalization, and then you start seeing a high number of deaths. And we have been reporting deaths nearly every day, oftentimes multiple deaths, and the numbers have gone up quite dramatically. So, of course, this is a terrible outcome for our community, and we just want to pass on our condolences to all the family members of those who have passed away. We know it's very trying, especially this time of year. So our condolences go to all those Shasta County residents experiencing that grief and pain right now. There's a lot we can all do, though, to stem the tide. We do have a vaccine right now that is being administered to our healthcare professionals, and will soon be administered to residents in our skilled nursing facilities and assisted living facilities for our vulnerable population. But the reality is, the number of doses available are still quite small, and we can all do a lot more to prevent spread, hospitalizations, and deaths by wearing our masks and refraining from gathering with those outside our household. So that is really our Christmas message. We hope that everybody has a very happy holiday this week and next, but if you can stick to your own households and your celebrations and use your online tools to see and fellowship with your family members, that will go a long way toward keeping our community safe. And of course, when you go out in public, wear your face covering. Those measures are the most important right now, and as we start getting the vaccine into people, that's going to help us. But right now, we need to stick with those preventive measures.
All right, thank you, Donnell. Dr. Ramstrom, did you have anything you'd like to start with?
I think Donnell said it all. Thank you, but happy to answer questions.
All right, great. Robert or Mark, do you have anything you would like to share today before we go to media questions?
I think just the reminder, Donnell, I appreciate your words. This is another one of those moments in time where there's potential for folks to gather. So we always get a little concerned when we look 2 to 3 weeks out. So we'll certainly have our eyes open. But I just want to send thanks to our physicians and our staff. It's you know, the year never got slow. Believe it or not, there are kind of seasons within hospital environments, and this year it just never felt like it slowed at all. So we have folks that are going above and beyond every day. We have folks that have agreed to work some extra shift to cover for others. We have many travelers coming in the next week or two as we again continue to prepare for any potential surge. And then I want to put a special sort of thank you to Dr. Ramstrom and Region 3 EMS. We had a call this morning and we had a larger expanded group than normal. So again, when we talk about how we prepare for the community and how we are making sure that we're ready, that was a great phone call today. So it went beyond our normal Region 3 folks, and it included an entire other region. So it really felt like we had everyone from the Bay Area north. So I hope that brings confidence to the community, but not so much confidence that we stop wearing our masks. And then as far as vaccinations, we started our vaccination clinics within the hospital last week. I'm pleased to say we will likely have vaccinated about 700 of our staff and physicians by the end of today. That's kind of our goal. So we feel like we're at least halfway to vaccinating our entire Tier 1 workforce.
And for SRMC, just kind of echoing everybody's statements, Merry Christmas to everybody in the community. Our vaccination program is going very well with the help of Mercy and the county. I think as of today, we've done about 400 vaccinations, and our entire staff is only about 1,000. So for us, that's a very nice percentage so far, and we have multiple clinics coming through the next couple of weeks to make sure we get as many individuals vaccinated as possible. But like Robert said, the coordination through the last few months has been amazing. So just Merry Christmas and thank you to everybody for the collaboration. We've really done a great job as a community.
All right, thank you, everyone. We are ready for media questions if you all have some for us.
Good morning, everybody. It's Anna here from Channel 1224. I just want to know, what's the status of the Moderna vaccine? I've seen other parts of California have received Moderna. Has Shasta County received the Moderna vaccine yet?
Thank you, Anna, for the question. Yes, we received our first shipment of Moderna vaccine yesterday. And so we're currently having conversations about distribution of those vaccines, and we'll be making those decisions soon. So we're very excited. We received our initial numbers about what we anticipate to get next week, but we'll wait and see. Things are kind of shifting every day, and so that could change over time, but we are also set to get a shipment of Pfizer and Moderna next week. We just learned yesterday.
Thank you. And then to follow up on that, how many doses of the Moderna vaccine did the county get? Was it about still 2,000?
Yes.
And then what is the Moderna vaccine? Is it like how the Pfizer one, where it was stored at Mercy, where it was the staging site? Where is Moderna being stored to?
So the Moderna doesn't require that ultra low freezer. And so we're able to store it in our regular vaccine freezer at Public Health. And it'll make it easier for handling, also to be shared in more outpatient settings. There's less concerns about temperature management for that vaccine than the Pfizer.
Has that already been distributed to the other hospitals here in the county, like Mercy, or discussions, let me rephrase that, have discussions about how that will be distributed? Are those still in the works right now about how they to be given in the other hospitals?
So yes, the Moderna, so we have a meeting this afternoon, and we'll be talking about that with our task force.
Other questions?
Oh, sorry, I have some more. I have a few more right here. Do we still have a timeline for when, other first responders will be able to get the vaccine. You know, I was talking to like the fire department last week, and they said they know they're on the list, but they're just still waiting to go when they're next.
So right now, we're really focused on that first phase 1A, which is includes our healthcare workers and our skilled nursing facilities, assisted living, and comparable kinds of residential care facilities. And so a lot of work to go in phase 1A still. And it also, we need more vaccine to get through those groups. And so we'll be doing that for the coming weeks.
And then Donnell, you also mentioned skilled nursing facilities getting vaccinated soon. Do we have a timeline of when they'll be getting the vaccine? I know last week it was mentioned they've signed up through a program through the CDC.
Right, so there's a CDC pharmacy partnership program that all of our skilled nursing facilities are signed up with, or they have other mechanisms to get the vaccine and provide those in their facilities. It was scheduled to start next week, and we're still trying to get information on the exact start date for the various facilities. We know some of them have received notification from that program about dates to get vaccinated in January. But statewide, there's a lot of questions about how that's being rolled out, and we're all just sort of learning. And we'll probably know more in the next week or two, specifics on when those facilities will get be on the list to have the pharmacies come in and do the vaccination for their workers and their residents. And in the meantime, we're looking at our skilled nursing facilities to determine those that are having that are higher risk. And so we'll talk to our task force about that this afternoon as well, and determine if we have the ability to start getting them vaccinated rather than waiting for the partnership program to be implemented.
Thank you, Dr. Ramstrom. I do have one more question. Last week it was mentioned that the Pfizer vaccine comes with one vial comes with 5 doses. What about the Moderna? How many doses does one vial come with, if anyone can answer that?
I don't remember, it's about the same, but the numbers that you have are doses. The 2,000 are doses. And of course, we'll see, we're learned with the Pfizer that we got more than we expected out of each vial. So we'll see what happens with Moderna. And I think over time, I know Pfizer's looking at that, and whether they will formally come out and say there's more doses per vial, or if they'll change what they're doing, that's yet to be determined. Other questions? Everybody's nice and quiet today. Okay, last
I have
call.
one.
Oh,
Can you
Donnie,
hear me okay?
you can,
you
sure,
hear
go
me
ahead.
today? Can you hear me?
Yes, yes, we
Yay.
can.
Okay. Do we have a way of knowing the location? Okay. Can you tell us the location of the residents of the people who have died within Shasta, like by city, like Palisadro, Redding, Shasta Lake?
I don't have that information in front of me. So no, we can't provide that today.
Donnie, we are going to work on some data for our deaths, and now that we've got such a large number, we think that we could probably put something out. So we'll work on something, and after Christmas, we'll be able to get that out.
Okay, thank you. And another question is there a mechanism for the people who are receiving the vaccines to see the side effects and reactions?
I'm sorry, I missed the first part of your question. Is there a what?
Is there a mechanism to track the side effects of those who have received the vaccine?
Yes, so for all vaccines, there's a mechanism for reporting vaccine adverse events. And so that's been in place for many years for all vaccines. And then there's also information available to individuals to report, and they're provided information on the FDA fact sheet about how to do that. And there's also reporting that would be happening to the manufacturer too, so that they can keep track of those kinds of adverse effects.
Thanks.
Any other questions?
Actually, sorry. Well, I can still have you guys here. I do have a few, just a couple more. Are there any concerns for, Christmas surge? I know, Donnell, you said the message, really, while we do have vaccine out, we don't have, enough for everyone just yet. So are there any concerns we could see more cases after the holiday?
Yes, we are concerned about that. We did see our numbers go up after Thanksgiving. We understand the social needs people have. We have them as well. So we're just asking for people to really look at their plans and modify them, and try to reduce the gathering as much as possible. And if they are going to gather, do so outdoors with masks. There's a lot of ways to reduce risk. It's all about the risk of transmission. We know the risk is higher inside. We know it's higher. People spend more time together in close contact. So there's a lot of ways to reduce the risk, because we really want to try to keep those numbers down, because we know that when we get those kind of surges, then we end up with our vulnerable people being exposed, and then they end up really sick in the hospital, and many of them have to get care in the ICU, and unfortunately some of them pass away. So the more we all can work together, reduce transmission, the fewer of those poor outcomes we're going to have at the end. So we are concerned about it. We're concerned about it for Christmas. We're concerned about it for New Year's as well, or New Year's Eve. So we are asking people not to gather and to continue using those face coverings in public.
Did you have any other questions, Anna?
I think that kind of covers it for now on my end, at least.
Okay, anybody else have questions? All right, hearing none. Everybody please enjoy Christmas Eve and Christmas Day, and we will be back again next week, Wednesday, for our next media briefing. Everyone stay safe and healthy.